morning. We're here today to talk about the process of doing an ankle-brachial index. You would do an ankle-brachial index to establish the quality of arterial flow, especially in patients who have lower extremity wounds and who you are thinking about using compression on as a treatment. The setting today is an outpatient wound clinic, so part of our normal new patient workup for patients with lower extremity wounds is to do an ankle-brachial index. So today we're going to demonstrate the process of obtaining that. Now also remember that if the patient is a diabetic, an ABI can be falsely high, but we'll talk about that after we get the results of this test. First of all, you put the manual blood pressure cuff on the patient's arm on the side that the wound is. And then you just use the stethoscope and manually obtain this blood pressure, the systolic blood pressure. Then you take the blood pressure cuff and you wrap it around the ankle. And if you have a wound on the ankle, you just, it's fine to do it on top of that. You just cover the wound with a sterile gauze and then try to wipe the cuff off after that. Prior to inflating the cuff, you want to use your Doppler and locate the dorsalis pedis pulse. And then you inflate the blood pressure cuff to the point where you obliterate the sound, and then the first sound you hear is your ankle pressure. So then, if you don't have a chart, you just divide the ankle pressure by the brachial pressure to get your result, a normal result being 1.0. So naturally the ankle pressure should be just the exact same thing as the systolic pressure. We have a chart as kind of a cheat sheet. So you locate the brachial pressure of 110, the ankle pressure of 110, and you come up with 1.00. So, and that is a normal ABI. Now, with the diabetic population, you have to remember that oftentimes their vessels are calcified, so you can't rely totally on this as a diagnostic tool. If there's any doubt about arterial flow because of the appearance of the extremity, you'd probably want to go ahead and get an MRA or a CT angio to demonstrate the quality of the arterial flow. So that's our lesson in ABIs for today.